Hi, this is Brendan Cronin. This instructional video covers all of the information that you need to know to make your cross-linking recovery as smooth as possible. If you had your procedure at the South Bank Day Hospital, you'll probably be watching this in the post-operative area. I appreciate that you just want to get home, but you need to stay for a set period of time as per hospital guidelines. Just lie back and have something to eat to pass the time. Your post-operative drops are really important. You will have three main types of drops: antibiotics, anti-inflammatory or steroid eye drops, and lubricating artificial tear drops. It's absolutely critical that you use them to ensure a routine recovery. This includes the lubricating drops. Even if you feel that your eye is constantly watering for the first few days, make sure you use your lubricants. Many people incorrectly stop the lubricants when the antibiotic and steroid drops finish. Please keep them going. Everyone gets dry eyes after the procedure. Some people will feel this as a dry, scratchy sensation, but most people notice it as blurred vision that clears up when they blink. Some people will even have excess watering because the tear layers are not in balance. This dryness tends to last 6 to 12 weeks. Use the lubricants as instructed to help the dryness to disappear faster. Using these is really important for a good visual recovery. It is important that your eye drops are 5 minutes apart so that one drop has had time to soak in, so that the next drop doesn't wash the first one out. The eye can only hold one drop at a time, so there is no need to worry if you use more than one drop, but there's no advantage in doing so. Sometimes in the first few days when your eye is really uncomfortable, it can be hard to do the drops yourself. If this is the case, get someone else to do them for you, and always use the lubricating drops last. You will be given a written version of these instructions. It has a tick box sheet on it to make complying with your eye drop regime easier. If you prefer, there are also apps for your phone that will remind you when your drops are due. Your drops only need to be roughly evenly spaced over normal waking hours. You do not need to wake up to do drops. However, many people use the lubricants overnight in the first few days, as their sleep tends to be disturbed anyway. With your post-operative medications, you will also be given a bottle of compounded dilute local anesthetic drops. These should be very effective at taking the sting and discomfort out of your eye. Use them up to hourly as often as you need to, but only use them for 3 days after the procedure. Throw them out after 72 hours. These drops should work very quickly. You do not need to wait 5 minutes after you instill these local anesthetic drops before you apply the anti-inflammatory and antibiotic eye drops. Everyone gets a sore and painful eye after cross-linking. Sometimes the pain won't start for 4 to 12 hours after the procedure, but it will start. Stay ahead of the curve. Don't wait for your pain to start and then take your pain medications. Take the medications before the pain begins so that the pain never gets too bad. Your Palexia dose may be 1 to 2 tablets. Check the box, as the dosing may be different for different people. Most patients say that if they are in bed with both of their eyes closed and that they have had their oral analgesia, then they were either reasonably comfortable or mildly uncomfortable, but not in pain. It's when you try and do more than this that you get into trouble. Occasionally I will decide that you need a special bandage contact lens inserted in your eye at the end of the procedure. This lens is designed to act like a bandage and smooth over any rough parts on the surface of the eye. Most people don't need one. The staff will advise you if you have a lens in. If this contact lens falls out, just leave it out. If your contact lens is irritating and you're happy to remove it yourself, then feel free to do so. If you normally wear soft, hybrid or hard contact lenses for good vision, you must not resume wearing these for a full 2 weeks after the procedure, as you cannot wear contact lenses when you're using the MaxiDex drop. Obviously, this excludes the special bandage contact lens that might be inserted. So what can you and can't you do after the procedure? You can shower and wash your hair as you normally would. You can wear your glasses, but your vision will be blurry and the prescription may need updating in a couple of months. You can exercise and return to normal activity as your pain resolves. And you can look at a computer, a phone or a tablet or read a book. But in reality, however, most people don't really want to do any of these things for the first couple of days. So what can't you do? There's no eye makeup for 7 days. That's really important. Eye makeup can be dirty. And no swimming for 14 days after the procedure or until you're given the all clear at your 1 week check. As discussed previously, do not wear your contact lenses for 2 weeks, and of course no driving until your vision is completely back to normal. So what does a typical recovery look like, and when can you return to work? Generally, as I've said, you're pretty sore for 48 hours. This can be very variable, as some people will recover remarkably quickly and others more slowly. You don't want to do much for this first 48-hour period. Usually, by 72 hours, your pain will have completely gone. Your eye might be irritated, scratchy, or uncomfortable, but it is not usually painful at this stage. By the 4th day, almost everyone is perfectly comfortable and back at work. Your vision will still be blurred. This is normal and may persist for a few weeks. Remember to continue your drops. Emergencies after cross-linking are extremely rare. If you feel you do have an emergency following the surgery, please use the contact details provided in your post-operative booklet. Small issues are much more common, and these will often happen over the weekend. If you do need to ask a question or have a concern, please feel free to send me a text message if it's after hours. I find people are more inclined to ask questions or raise concerns if they feel they can just send a text message. I only ask that you include your full name, the fact that you've had cross-linking, and the date that you had the procedure performed. I don't have your contact details in my phone, so this enables me to answer your query more quickly and allows me to look up your medical record if I need to. Cross-linking is a brilliant procedure for keratoconus. Yes, it hurts afterwards, but I'm still old enough to remember the days when we didn't have a good treatment to stop keratoconus. Remember, you are actually quite lucky. The Queensland Eye Institute has the most advanced cross-linking machine in Australia. You have had cross-linking on the only machine in the country that actively tracks your eye movements and can deliver more energy to the steeper parts of your cornea to actually try and improve the shape of your cornea, not just stabilise it. I hope you recover very rapidly from the procedure and get back to your normal life and normal vision as quickly as you can. It's always nice when the procedure is finished and the discomfort has completely resolved. If you have any ideas on how the process can be improved or any feedback, I'm always happy to hear that. Just drop me a line or send me an email. If you have been really happy, a 5-star Google review goes a long way towards relaxing future patients who need cross-linking.